Earlier this morning, we heard a reference to the groundbreaking and early investment by Robert Wood Johnson Foundation, a number at that time of $500 million. Robert Wood Johnson has been a part of the work here at the National Academies since that time. Representing RWJ today is Monica Vinluan, and we're very pleased you're here.
Hi, and thank you so much, Marion, for starting this off around the context of values and social movements. I do indeed feel that we have seen progress in declining rates of obesity, in particular for our youngest children in this country, because of the fabric and the weave that we're putting together of building upon multiple social movements to try to advance this work. So in my perspective, I think that there's a number of movements that have been active and have been doing this work for a long time, and how we actually find the intersectionality between those movements to advance this work. I think that that's the key to our future. When we think of values at the Robert Wood Johnson Foundation, we very much feel that if we're holding steady at our obesity rates, or if we're seeing slight declines in certain age groups, but still seeing widening disparities, for the foundation, our value is that's not a success. Right? If our disparities continue to widen and the gaps continue to increase, we're not actually making the progress that we need to be making. So at the Robert Wood Johnson Foundation, is exactly as have been shared and talked about, the foundation has invested $1 billion over the last 10 years, and there's a lot of things that we've learned along that journey. And I would say, in part, because of many of the folks sitting in this room, of how we've learned where we've come from, what we've learned. We definitely know that how we now understand better how health and well-being are unequally and unduly connected to race, ethnicity, education, income, and zip code. We know that for sure now. We didn't know that necessarily as clearly as we do now. But we also know that there are a lot of different strategies that have been at play for a while, and how we lift up those strategies of what's working in communities and in states, indeed in states that are actually seeing decreases. We also know that when young children experience poverty, hunger, family violence, or substance abuse, that they're more likely to drop out of school, end up in prison, or become addicted to some type of drugs. So we know that now. We know that these intersectionalities and these overlapping issues are there. Going back to Marion's point around movements, how do we weave together the advocates, the policies, the strategies, the environmental factors that are making all these conditions happen to try to advance and truly achieve progress and actually closing the gap, the disparities gap. At the Robert Wood Johnson Foundation, we've been investing in a number of different strategies, as you all know. We've also have created a Culture of Health Prize. And that Culture of Health Prize, what it's in addition to awarding amazing communities that are doing great things, we're also doing it for the purpose of trying to share and disseminate what's working. What we do know what works, there's two main things that we have figured out in this journey of achieving and trying to define success, is that the communities that are doing this well are prioritizing this issue of childhood obesity prevention above everything else. That is their primary strategy, whether they articulate it like that, or whether there's several movements that are giving voice to different aspects of the childhood obesity movement, but that is the priority that they're moving forward. And the other piece that we know is that they're implementing a wide range of strategies with multiple sectors. There's no true one way to do this, and that there's no true one path to achieving the outcomes that we know. We also know that in order to build a culture of health, we need lots of component pieces in place. We need to make sure that health is a shared value. We need to make sure that we're fostering cross-sector collaboration, and we need to create healthier communities, at the same time integrating our health services and systems. The last thing I'll just end with sort of the so what. So where do we go from here? I will surely say on behalf of RISA, we're not stopping now. We're continuing to move forward, and we're actually increasing our efforts around this intersectionality piece. We know our science has now told us and proven to us that health is very much connected around the conditions of social and emotional health as well as physical health. So how do we try to identify strategies and solutions that really combine all of those efforts? We want to focus on strategies that are fostering children's physical, emotional skills all day and all year long. We're going to be focusing our efforts in schools, in early care environments, of course at home, and in our communities. Those are going to be our 4 primary strategy areas that we're going to be really doubling down our efforts. And I know that all of this work will be connected, of course, to also identifying tools and strategies to help communities and families address trauma and toxic stress that are very much conditions and elements in many of our communities across this country. So that's where we're going, and I invite you all to join us in this journey.